Rhemsys is a nimble, agile platform that was developed by doctors to improve patient engagement, compliance, and outcomes. The platform utilizes automated algorithms, hard-coded artificial intelligence, real-time data, and quality metrics to improve patients and their own care, as well as keeping healthcare providers and family constantly informed. It's a true end-to-end platform that allows the healthcare team to monitor patient progress outside the practice office or after a hospital discharge, leading to timely interventions, preventing disease progression, unnecessary hospitalization, or hospital readmissions. The Rhemsys platform is made up of 3 distinct areas. Patient app with monitoring. Its purpose is to encourage daily engagement and compliance. It was built with the patient in mind to be a simple interface, suitable for older patients, having large buttons and intuitive logic on how to use the different features. Rhemsys reminders for you, notifications, reminders, and pillbox functions. Engages patients with their health status. Connects patients to healthcare team. Connects with self-monitoring devices for remote data collection. The Physician Portal, or as we call it, the PSC. This is where the care team will access and edit all of the patient medical information and drive the ship. It can manage patient medications remotely, RPM and CCM documentation, provide patient notification, helps closing the care gap, connects with the current EMR systems, ability to link to current billing and cost coding. Central Monitoring Station, or HOC as we call it. This is where the team monitors the patient, enables the care team to deploy resources and direct care if there was an emergency. The team that is responsible for the HOC can be the care team or a different individual. This is what is great about the system. The flexibility. The HOC plays a vital role if there's an issue that arises and the patient needs support. Other features of the HOC include immediate notification of patient issue with essential info easily displayed, automated communication with the patient's family member via text and email, GPS locator of last known location of patient. Remote patient monitoring. Rhemsys is an end-to-end solution that involves hands-on and user-friendly interactions between patients and care providers in real time. Rhemsys allows the patients a transparent control over their own health and also have a more direct contact with the care providers. The platform allows continuous monitoring of patients electronically via inbuilt artificial intelligence with a simple setup of demographics and chronic conditions. This can result in real-time, individually tailored remote monitoring and reminders via a user-friendly patient app via custom state-of-the-art yet economical Bluetooth devices that connect to the app that immediately pushes data in real time to PSC and HOC portals, which are managed and visible to care providers round the clock. In response to this data and electronic reminders, care plan practices can remotely monitor with the ease of just a few clicks and intervene if necessary via telehealth on Rhemsys or any necessary form of care coordination when a threshold is breached. These encounters are all easily recorded. The platform setup ensures care gaps are bridged by innovating a new care pathway. This results in an increase in compliance in self-monitoring and medication administration, decreased practice visits, hospital admissions and readmissions, all leading to a reduction in healthcare costs while creating extra time for care providers. Better outcomes and lower costs, a winning combination. First, you must make sure that your device settings has Bluetooth enabled. Then proceed to log into the Rhemsys mobile app, select the Monitor button and click the corresponding monitoring module. Glucometer. Click on the Power button located at the top of the device. Once it's enabled, insert the strip into the slot located at the top of the glucometer and prick the finger for a blood sample. Results will appear in the device window. Then press Start in the Rhemsys Glucose module, wait for results to appear within the app module, confirm results are accurate and click the Save icon button. Blood pressure monitor. Place forearm in the BP cuff and fasten strap until a snug fit is reached. Then click on the Power button that is located on the side of the display screen of the BP device. BP results will display on the device screen and then press Start in the Rhemsys BP module. Wait for results to appear within the app module. Confirm results are accurate and click the Save icon button. Weight machine. For weight recording, you will be clicking on the Health Status button instead, and then click on the Weight module. Select the Power on the weight device to enable. Stand on the device while it's placed on a flat surface. Be sure to evenly distribute the weight on your feet. Once results are displayed on the device, click Start in the Rhemsys Weight module. Wait for results to appear within the app module. Confirm results are accurate and click the Save icon button. SpO2 Pulse Oximeter. Press the Power On button on the pulse oximeter device. Insert your finger into the device. In a few seconds, the results will be displayed on the device screen. Once the results are displayed on the device, click Start in the Rhemsys Pulse Oximeter module. Wait for results to appear within the app module, confirm the results are accurate, and click the Save icon button. Patient engagement. Going on the previous alert and reminder setups, we can track a patient's progress on either a daily, weekly, monthly, or yearly basis. These alerts and/or reminders are sent to the patient's mobile app with voice and/or banners commands, depending on phone settings in either English or Spanish. Upon receiving these reminders, the patient can then enter their vitals or record their medication intake, resulting in real-time remote monitoring from the PC or the HOC interfaces. You can view track results by clicking on the final More Info button within the PSC module. From the patient profile, click on the graph icon on the far left, and finally, clicking on the Vitals module icon you wish to monitor. The same steps are repeated in the HOC, but to get to the patient profile, simply click on the patient name within the HOC. Above the graph of the progress, you can decide how you wish to view the data. The CCM Patient Encounter and Telehealth Tracking modules allow for the seamless ability to bridge advanced models of care coordination and patient engagement. Modules were specifically designed to allow for interaction with the patient's caregivers and care teams, with the ability to document and track the various interactions. For ease, pull-down menus, timing tracking, and note-taking ability has been designed within the modules. The telehealth modules represents one of the more unique functions within the Rhemsys platform and is very different from many other telehealth systems. Specifically in that the Rhemsys platform allows not only for the ability to see and speak with a patient, but also provides the flexibility to see a patient's vitals and health data in real time. This is vastly different than other systems. You are basically engaging in a FaceTime call. Telehealth is often used whenever a threshold is breached and an alert is generated in the HOC or PSC portal. To reach a patient in the PSC portal, select a patient and click on the telehealth icon, which is the last icon at the bottom right side. This will take you to the patient profile. From the profile, click on the web or app button and then click on the video or telephone icon to reach the patient. A call will then be directed to a patient app to which they can either respond or decline. How to track and record. Once a telehealth call is terminated, it will automatically display a clinical doc page. The minutes taken on the event and the action type telehealth call, medications, reconciliations, etc. can be recorded. The disposition of the event status can be either changed or closed, forwarded to a nurse, reminded, or working. Notification emails will be generated and sent to the chosen care coordination team and family, provided that they decided to accept the notifications only when a threshold is breached. Another notification will be generated for the recorded action ticket in response to that threshold, which is essentially the auto-generated screen you receive upon ending a telehealth call. The Rhemsys platform is designed to capture analytic data at both the patient and practice level. This data allows the care team to proactively intervene with the patients, or at the practice level to track the overall practice's quality measurements. Analyzation can be done at the patient level with the PSC HOC portals from the patient profile. It's housed within the Reports buttons. These screens are accessible via the patient profile and then selecting the Reporting module button on the far left-hand side. Once this view is present, select on the vital icon below the graph to view the desired information, and on top of the graph, select how the data is desired to be seen: week, month, or year. Color-coded legend besides the right side of the graph will show the goals, thresholds, and the real-time data recorded. Quality Measurements Analyzation. This is housed within the Reports button. Currently, there are over 20 quality measurements that are captured. Quality measurements are initially shown at the practice level. The color-coded breakout within each measurement will show the number of patients that have been compliant or non-compliant to each of the quality measurements. When you click the desired section of the graph, it will bring you to the patient level to see the specific patient's names. From here, you now have the insight to decide if a specific campaign would be beneficial to launch and to which specific patients you may want to reach out to that have been non-compliant. Again, the sole aim is to save valuable resources but still improve care and provide better outcomes for patients. Linking patients with healthcare professionals.